These days, I've heard so many girls talking about PCOS, PCOD. I mean, what do they mean, or is it just being diagnosed more these days?
And we have become the capital of diabetes in the world today. Similarly, we've become capital of PCOS in the world today.
What could be the early signs that young girls and parents can watch out for when it comes to PCOS and probably work on it?
My youngest PCOS today is all of 9 years old when I first diagnosed her. The children, you see them getting obese suddenly. So the minute you see that the fat is getting deposited around the abdomen, you know something is going wrong somewhere.
When they start getting their irregular periods, at what point they should come and consult a gynecologist?
I normally tell them that when they start getting their periods, now you bring them to me. Let me decide. And the child is also more comfortable listening to it from a third person.
Pregnancy stage or pre-pregnancy stage, I think there might be some traditional practices also. Could you throw some light on this part?
See, it is very easy to blame. आजकल के डॉक्टर सिजेरियन करते हैं, पैसे बनाने का धंधा है, बट खाने वाले आप, खिलाने वाले घर वाले, डॉक्टर को क्यों गाली दे रहे हो भाई? हम क्या करेंगे? हम तो पेट पे बैठ के धक्का मार सकते हैं, उसके अलावा तो हम कुछ नहीं कर सकते. So ideally, the entire pregnancy is 4 to 5 kilos. पर हमारे यहाँ 15 किलो, 18 किलो, and then they want to have normal deliveries.
Like I have 2 children. Now people keep on asking this question, अच्छा family planning operation किया? What do you have to say about that?
If I can tell you in very simple words, Tanvi,
Before a woman becomes a mother, before she becomes a wife, before she becomes anything the world expects her to be, she is simply a woman navigating a body that changes with every phase of life. From the confusion of PCOS as a teenager, to the emotions of pregnancy, to the silent battles of menopause, women go through a journey most people barely talk about. Welcome to Hustle and Heart with Juhi and Tanvi. And today we're having the most honest conversation about a woman's health from womb to tomb.
Today's guest is someone who has quite literally been part of most the life-changing moments in a woman's journey. Dr. Anita Soni is the Director of Obstetrics and Gynaecology at Dr. H Hiranandani Hospital and has been associated with the hospital since its beginning in 2004. With qualifications including MD, DNB, FCPS, and DGO, she brings decades of experience in women's health. From helping couples navigate fertility challenges to managing high risk pregnancies to guiding women through different phases of their health journey, Dr. Soni has seen it all and helped thousands of families welcome new life into the world. Dr. Anita, we are so happy and honored that you have come to Hustle and Heart today.
thank you so much, both of you, for having me over.
Yeah. So, ma'am, let's begin. Since we are talking about womb to tomb, let's start with adolescence phases. These days, I've heard so many girls talking about PCOS, PCOD. Is it just these words? I mean, what do they mean? Or is it just being diagnosed more these days?
Okay, PCOS, to explain to you, is not just alphabets. It is a hormone imbalance which you are picking up much today because it does exist more than it did in the good old days. Do you realize that it is a genetic issue which has got influenced by epigenetic factors? What do you mean by genetic issue? Basically, diabetes in the family, when there is someone with diabetes in the family, that is the only time the girl will have PCOS. What is PCOS and what is the difference between PCOS and PCOD? PCOD is ultrasound morphological appearance. PCOS is a syndrome complex. Obesity, chronic anovulation meaning irregular periods, hirsutism or hyperandrogenemia where you have a lot of hair on your face, acne, and infertility. So all of it is a syndrome complex. Now in 2026, most likely the name will get changed or is on the verge of changing, where they're going to call it a metabolic syndrome. So it is to do with the metabolism of food in a girl, and that is why the name is what it is. Having said that, Why is it being picked up more? It is because it is existent. We have become the capital of diabetes in the world today. Similarly, we've become capital of PCOS in the world today. There is nobody else who's more than us in these numbers. Secondly, why is it happening? Awareness, where we're aware more of what the problems can be, what their presentations can be, and exactly what is going wrong in their bodies. And two, our urban lifestyle. If you look at the incidence, there is a stark difference between the rural population and the urban population. Maybe it's just to do with our lifestyle, food, eating, and all the rest that goes with it.
So, which is better, rural or urban population, according to you?
Well, to be very honest, the urban lifestyle is way better in certain cases because you have an educated class, and in factual life, the rural lifestyle is way better. But the urban people will not adapt to a rural lifestyle. Put yourself in such a situation and see.
Absolutely. What could be the early signs that young girls and parents can watch out for when it comes to PCOS and probably work on it?
So, well, we can start. My youngest PCOS today is all of 9 years old when
Oh
I
my
first
God.
diagnosed her.
9 years.
Yes, ma'am. So, you're talking about adolescence, which would be 14, 15, 13. But I first saw this child when she was all of 9, little roly-poly girl. And the reason I got called was because she would refuse to wear a sanitary pad because she had got her periods. Okay, so the school principal called me saying, Anita, do something. This child comes, mother dresses her up, puts a pad on, sends her to school. In the short break, which is 10 o'clock, she'd go and throw a pad. By lunch break, which was 12:10, her clothes would be soiled. And I had to find a solution for her. So that is how early it is affecting children today. Yelling, hollering, screaming is not going to help the child. It is trying to come down to her level. I sat on the floor with her. I told her this is an auntie's pamper. She had a sibling who was just a couple of years old who was using a pamper, a diaper. And I said, this is what you need to do. And after that, I never got called because she was not wearing a pad, a sanitary pad. But the fact still remains is today we're picking it up much earlier than what we used to diagnose 25, 30 years ago. The children, how do you see them getting obese suddenly? There's a little growth spurt. Suddenly you will see hair appearing on their face and their side locks. They start becoming conscious of themselves. They get a very thick upper lip. They break out in acne. These are the things that you can look for, you can find out. And the one thing that you should track is her abdominal circumference vis-a-vis her height and body. So the minute you see that the fat is getting deposited around the abdomen, you know something is going wrong somewhere.
And we do listen about so much irregular periods also happening in girls. I mean, when we were in our college days, I got my periods in school. Not even I got it quite early, but it was my nanny also got it early. My mom also got it early. So did I. I think 5th or 6th standard I got my periods, and my friends did not know about it. I was the first one. So that early, my mother had to sit down and counsel me. So I can recollect to what you can say that in what mindset or in what mind frame I was at that time. Literally, girls used to run behind me to see, "Arey, kya ho raha hai? Isko kya ho raha hai?" They
Exactly.
become
Nobody
so
wants to talk
curious.
about it. And unfortunately,
Yeah,
it is so hush in the homes
yeah.
that the mother barely is allowed to say anything.
Yes.
In fact, I feel it should be a day of celebration. There are certain class or
Communities, yeah.
communities
They do.
where they
Yes.
actually get their
Celebrate.
child to dress up,
Yes.
feed her. And from being daddy's little girl, she now becomes mama's young princess.
Wow.
Yeah,
that
true.
should be the perspective, I think.
Exactly. You
It
shouldn't
is
be
it is an
hurting her.
honor
Hmm.
to, I think, have it. But however, the ages that we are listening about, 8, 9, 10, I think that is do you think 20 years back also such things used to happen
They
as
were
much?
few and far beyond. 25, 30 years ago, it was really,
Rare.
our incidence was then 6 to 7% of general population. Today, we're dealing with 18 to 20% of general population with the incidence of PCOS. But if you look at the affluent class that the kind of people that I deal with, it's nearly about 65%. And it's all to do with your genetics and epigenetics. So that is why I come back to one thing that I'm always yelled at about. Why do you get so personal? Why do you talk to people so much on diet? Let the dietitian do that. I said, because you don't realize the effect it's going to have on your body at different stages in life. It starts as young as adolescence. It goes all the way to menopause and beyond. Your body is only what you consume. So you have to be healthy, you have to be careful and stay alert. That is when you are aware of what the things that you should do and what you can avoid. And everybody keeps saying, पास्ता जाके खाते हैं, पिज्जा जाके खाते हैं. My argument is that इटली में PCOS इतना नहीं है जितना इंडिया में है. So it is not the pasta and the pizza, it's your damned normal ghar ka khana, which is disaster quotient personified.
But on the other hand, ma'am, I mean, out of curiosity, this is the diet जो हमारे forefathers और सब खाते आए हैं. अभी North Indians हैं तो wheat पे concentrated हैं, South Indians हैं तो rice पे concentrated हैं, काफी parts में जवारी बाजरा normal है. But I am a North Indian and हमारे में बोलते हैं कि हेरिडिटरीली हमको थिक हेयर ग्रोथ, फेशियल हेयर ग्रोथ आती है, ऐसा बोलते हैं. और हमने हमारी नानी दादियों को भी देखा है. तो फिर वो कोर से रॉन्ग है क्या वो टाइप का डाइट? मतलब वो उतने सालों से दैट डाइट इज रॉन्ग.
Can I explain to you?
Yes.
You're from North India. What is the temperature in North India? You need that little amount of fat on your body to keep your body core temperature lower so that you can survive these extreme climates. What is the weather like? Is it as humid as it is here? What are your homes like? You're talking about acres of land and huge homes. What are you living in here in comparison to that? It is variable depending on so many social, economic, genetic factors. That is why the child is the one that gets to suffer, because the parents come from that place. Like you said, हम तो wheat खाते ही हैं. बेटा जब आप दाल चावल सब्जी रोटी खा रहे थे तभी आप लगोरी, डबाई, स्पाइस, साकली, that's what we all grew up playing. आज कौन से बच्चे खेलते हैं? वो तो इडियट बॉक्स पे या तो ये इस पे या तो स्क्रीन पे वो बैठ के कर रहे. तो हाउ कैन यू कंपेयर what you did in terms of physical activity? For that you required food. Now you're doing nothing and you need the same amount of food. That's pretty hypocritical. आप रोज गाड़ी में पेट्रोल डालते हो, जितना गाड़ी चलाते हो उतना ही पेट्रोल डालते हो ना. ये गाड़ी में आप दिन में 4 बार फुल टंकी करोगे तो उसका साइड इफेक्ट कहीं ना कहीं तो आने ही वाला है.
Yes, true. I think that is why these girls are having so many irregular periods and issues. Absolutely. And how early do you think, when they start getting their irregular periods, at what point they should come and consult a gynecologist?
I normally tell them that when they start getting their periods, now you bring them to me. Let me decide. For the first year or two, it depends on when she started period. Now, if she starts at the age of 14, 15, you will not give her 2 years, which will be 16, 17 to get regular. You have to calculate her BMI, you check her height, you check her weight. All of that is subject to that particular child. So what you do is you take her to the doctor, let her get height, weight, talk to her, let the doctor explain everything to her, let the doctor explain the physiological changes that are going to take place in her body. And the child is also more comfortable listening to it from a third person. You cannot be the be all and end all of everything. We appreciate you. We are also parents, but I thought it was nicest to give an absolute rundown, explain to them good touch, bad touch, explain to them diet, explain to them hygiene, personal hygiene, explain to them sanitary pads. And if they want to go swimming and stuff, today we allow them to do everything. We also explain to them tampons. So there's nothing wrong with any of it, but let us do the talking, because every mother has had her own preconceived notions about everything. So she will only tell what her mother told her, which not necessarily is always right.
Moving on to the next stage, the pregnancy stage or pre-pregnancy stage. Obviously, I'm in my 3rd trimester right now, and I can only, speak hours and hours about the amount of advice, unsolicited, sometimes solicited advice that we, there's a lot of information overload. And then there are many myths, but I think there might be some, some points in the traditional practices also. Could you throw some light on this part?
Well, I will start with preconception. Preconception, it is mandatory today to get all your tests done. Things like thalassemia, things like rubella antigen, please get it checked, because there are things that are so very preventable. Beta thaltrate, so many, especially the Lohana Kachis, Sindhis, they have got a very high incidence of it. And people are realizing only after they get married they're beta thaltrate positive. Then we've got to screen the husbands. If both of them then go through further testing to check if the baby is thal minor, thal major, because when two thal minors get married to each other, there is a 50% chance the child can be a thal major, which is incompatible or poor quality of life. So please do these tests before you even plan a pregnancy. Your rubella antigen, if you are immune, because not everybody has their immunization schedule which they have taken in their childhood. So we don't know whether you're immune to rubella or no. Now, rubella is preventable. Complications of rubella are preventable, and rubella in pregnancy is absolutely life-threatening to the child. Try and get down your body mass index or your weight by even 5% of whatever of your weight if you are obese. With every 1 kilo lost in pregnancy, there is an improvement in your baby of approximately 10%. Lesser complications, lesser problems if you are lower than your original weight. Second, start your diet, healthy lifestyle. Consult a nutritionist. If not, ask your obstetrician and gynecologist what she would like. See, it is very easy to blame. आजकल के डॉक्टर सिजेरियन करते हैं, पैसे बनाने का धंधा है, बट खाने वाले आप, खिलाने वाले घर वाले, डॉक्टर को क्यों गाली दे रहे हो भाई? हम क्या करेंगे? हम तो पेट पे बैठ के धक्का मार सकते हैं, उसके अलावा तो हम कुछ नहीं कर सकते. No doctor is going to risk her reputation for you unnecessarily. So please try and understand you are what you eat. So start getting onto a low carb, high protein diet. The myths that are associated, papaya, pineapple खाएगा तो गर्मी बढ़ जाती है, तो abortions के chances ज़्यादा है. टेस्ट इतने सारे नहीं करते हैं, सोनोग्राफी बाद में होता है. हमारे टाइम पे तो सोनोग्राफीज हुए नहीं. खजूर खाएगा तो अगेन गर्मी बढ़ जाती है. जवार बाजरा इज नॉट अलाउड, बहुत उष्णता बढ़ता है. अब घी खाने से बच्चा स्लीप आउट होता है. तो माय आर्ग्यूमेंट इज, सेक्स कर घी खाने के बाद सेक्स बहुत एंजॉयबल होता है क्या? उसी जगह पे होता है ना. It cannot, what you eat comes out through your anus, cannot go through your vagina, for God's sake. So what are we talking about? And if you put on weight, you have a bigger baby, you'll end up with a C-section. Aajkal ke doctor. Makes no sense.
Yeah.
So
very true. I think you explained it flawlessly. I know I increased only 4 kgs in my entire 9 months. Out of that, 2.5 kgs only in the last trimester.
Which is exactly
because I was allowed to eat calories only in the last trimester.
Yes, because your ideal weight gain is to be in after 28 weeks. See, there is science in everything. When you conceive, the baby is just developing. It is a bundle of cells. Those cells do not require any of your food that you're eating. They require 5 milligrams of folic acid, 1500 micrograms of B12. That's it that they require. गरीबों के बच्चे कैसे होते हैं नहीं तो? They develop. After the second trimester, where the development is complete, 24 weeks onwards is your growth phase. In that growth phase, the baby normally would kind of grow a little bit. At 24 weeks, an average baby weight would be about 700 or 800 grams at 28. So 24 to 28 is your window. After 28, the baby grows at the rate of 30 to 40 grams per day. That is your maximum growth phase. That time you eat. Now we are all allowing you to eat. And normal weight gain in pregnancy is 700 grams at that point every week. Otherwise, it is 700 grams a month. So ideally, the entire pregnancy is 4 to 5 kilos. But हमारे यहाँ 15 kilo, 18 kilo, and then they want to have normal deliveries. Irony of life.
I know, I've gone through 2 normal deliveries and can't even imagine if there was weight, it would not have been so easy.
Exactly my point. So this is an ongoing fight. I guess There are millennials, there are 2000s, and there are 1990s, and then there are 1970s, and we who belong to the 1960s are the cause of half the problems because we don't want to change with changing times. Everybody's changed their dress sense, everybody's changed their walk, talk, travel, life. But when it comes to food and when it comes to pregnancy, all the mais, nannies, daddies seem to have more authority than the doctors today.
While we're talking about physical health, I think emotional and mental health is equally important
I so agree.
during pregnancy. So, what do you have to say about that?
Every woman. See, today we're dealing with the educated woman. Gone are the days where women were housewives and they just sat down and they didn't do any work. And those were the only 40 days that they were allowed to rest. And the rest of the time it was chakki chalao, chula chalao, do all of that, jhadu pota, kapda bandi, which is a part of their lifestyle. How many women want to do that? None of us do it. Come on, let's be honest. हम सारे उठ के हमारा Netflix या तो Instagram, social media, हम कुछ ना कुछ करते रहते हैं. People like us go to work, deal with women every single day. And if you sit alone with them and talk to them, you realize how upset they get when they're not allowed to work. They were all working, even if they were saleswomen before they got married. They were financially independent, they were socially independent. Now for everything, mummy kya bolegi, saas kya bolegi, sasur kya bolenge, khana ready hai ki nahi, husband kya bolega. So there's too much to worry about, and the poor lady forgets who she is. And in pregnancy, she's also dealing with emotional baggage, she's in physical change. Nothing prepares you for all of this. So as much as you would like to say that she's very happy with all the change, there is something that's unnerving her inside. Her hand needs to be held. She needs to walk. She needs someone to just pat her back and say, "Main hu na." And they're so happy with just that much. So I keep telling my patient, "Tu ja, tu kar, main hu na. Hum dekhenge kya hoega. Don't worry. Just follow these basic guidelines and live your life. Be happy." The positive vibes, the positive attitude. You're literally manifesting not only for yourself, even for your child.
Absolutely. All
Very
the
true.
hormones, the right hormones secreted obviously play their own role in shaping the baby.
Absolutely.
And then, after you give birth, after the lady gives birth, her entire focus, entire attention shifts to the baby. And there are many mistakes I think she makes when it comes to taking care of herself. What do you think are the most common ones in this particular phase?
She forgets self and she's more bothered about what the mother and mother-in-law will say. That is the biggest mistake everybody says, because न घी खाने से बच्चा स्लिप हो रहा है, न डिंग के लड्डू खाने से मिल्क ज्यादा बढ़ता है, न गरम रखने से बच्चा सुखी रहता है. You need to have the ambient temperature at about 24-25. You need to be well hydrated for you to be able to produce adequate amounts of milk. Natural galactogogues are available, like Shatavari, those things definitely help you. There are medications which are available, which we try and give you and help you. But the milk is produced here. The breast is only the bottle that carries the milk from the brain to the baby. So if you are comfortable in your brain, you will produce adequate amounts of milk. Have you ever thought of animals who can produce a litter and nurse 4, 5, 10 puppies at one time? Women make an issue out of feeding one baby. And our pediatricians make it even more difficult, 30cc 3 hourly for all. It's not required. If you feel that your baby requires any amount of extra feed, why don't you express your own breast milk and feed it to the child? 30cc, what you give 40cc, you will never go wrong. Because not only does breast milk help with you with weight loss, you with looking much better, you with your own self-esteem and confidence, it helps your child with its immunity, its ability to fight infections. We've given you vaccines in pregnancy, the antibodies which cross the milk barrier and go to the baby. The passive immunity from there is so high that it generally helps your child. So why give dabbe ka doodh? And every dabba it is written mother's milk is best for child. So you want to do what is not the best for your child?
Very true.
It is very true. What are the little things which can be taken care of by mothers to lift their lift themselves up more when it
Especially
comes
during
to their
postpartum,
postpartum.
In the postpartum phase, for the first week, 10 days, leave them be. Give them a safe space where the husband is their only interaction. Let them get used to handling the baby. Don't get one japa who belongs to the dark old ages teaching you what is right for your child. How will you ever do any wrong to your child? You manage your child. Child कोई मट्टी में खेल के तो नहीं आ रहा कि you need to scrub, pull, tug, massage. None of it is required. If you just sponge your baby down or bathe your baby yourself, use a little bit of moisturizer. You can do kacha doodh, you can do any baby lotion, just kind of gently rub the baby's skin. Improves your bonding with the child. The child is so comfortable. You ever seen 3 घंटा बच्चा क्यों सोता है after massage? Because it screamed for 1 hour with in agony during that massage, and that is why it is sleeping for the next 3 hours. So give her that time to understand her baby. The minute she's there, take her out. Like I tell the husbands, let her dress up. When you're coming in the evening, call her from down. Just मेरे को गाली दे के मैंने सही से टाके नहीं लगाए. Take her to one of the local restaurants. Get her to eat something. Just let her feel positive and good about herself. क्या होगा, गाड़ी में breastfeed ही करना पड़ेगा ना. आजकल तो pamper तो use ही कर रहे हैं. So where is the issue? Take the lady out. Let her get back to normal. You don't have to stay 42 days eating particular kinds of food. It is absolute, in today's day and age, it's unheard of.
So moving on to fertility issues and the age at which these occur, what do you think is the age when these issues actually start to crop up, and when should women actually seek help for these issues?
Okay, it generally has to do with, as you age, your fertility decreases. A woman is born with some number of eggs. 50% of them have already gone by the time you've reached adolescence. Uske baad, every month you're losing one egg. So imagine your bank account, which had like 1 crore, which became less, and then every month 1,000 rupees is being taken out. When you plan a pregnancy, will depend on what your balance is, right? So in our times, that is, we who were born in the 60s, we planned pregnancies between 20 and 25. Then the next generation that was born in the 70s and the 80s started between 25 and 30. In those days, 30 was that sacrosanct number. Ke ek bacha to 30 ke pehle hona chahiye. But scientifically, to be very honest with you, 35 is as close as you get to danger area. Does it mean that women are not getting pregnant after 35? No, it doesn't mean that. It just means that by 35, you have now gone on the decline of your fertility potential. What you were at 25, you're now going faster downward than you're going upward or plateauing. So that is something one needs to understand. How does one decide, plan a pregnancy or no? Like this morning, I had somebody, Doc, we've been married 8 years, I've had 3 abortions, but I just want to know, can I delay my pregnancy for 2 more years? I am 37 right now. I said, beta, please do your AMH test. At least check, do your ultrasound, check your antral follicle count. Nothing else. You have the option of storing your eggs, freezing them and keeping. What is the difference? Why not? If you have the financial capability of doing that, it's like making a deposit for yourself. So in a rainy day, suppose worst comes to worst scenario, you are unable to conceive when you plan, you have a backup plan where you can use your eggs which are there.
Do you really recommend? I mean, I think recommend is not the right word, but at such an age, after 35, 37, by the time the child is, say, 15 years old, you've already crossed 50. So you think that is advisable?
It's not me
age?
to decide.
Absolutely.
It's patient to decide. But in today's day and age, if you sit in my OPD, most women I'm dealing with are more than 35 years of age. They don't want to plan pregnancies earlier.
Yeah.
So they might
Quite a
as
lot of
well not
couples.
plan. I mean,
or who am I to say that? Who am I to decide for anyone? I'm here to provide the right advice and the guidance and help them at whatever stage in their life they decide to cross whichever bridge. My duty is to help them tide over the crisis. But giving them honest facts does not make me a bad human being. So I counsel them, I educate them. And then the options are available. I have a girl who's turning 35 and she hasn't found Mr. Right. Now, instead of advising her to go and get into a relationship which may not result in a healthy marriage, I told her, why don't you just go and freeze your eggs? When marriage has to happen, it will happen. Don't panic, don't worry. At least you have this option with you. My friends.
Great
Yeah,
advice.
very
That's
true.
really
And on
great
the other
advice.
hand, if suppose there, like I have 2 children, now people keep on asking this question, "Acha, family planning operation kiya?" So, what do you have to say about that?
If I can tell you in very simple words, Tanvi, I'm a haurat nahi out. Today we're living in modern India where we're all educated people. When temporary methods of contraception are available, why are we talking permanent? Permanent sterilization and all was when Indira Gandhi rule, emergencies where we were bursting at our seams. We're not, when we are on the net, we're not dealing with the lower socioeconomic strata. We're dealing with people who come from the educated class and the higher economic strata. Now you can use IUD, you can take oral contraceptive pills, there are progesterone only, there are injectable contraceptions, there are so many dime a dozen options which are available. Interfering with nature, why?
Yeah.
If I can go on record and tell you, I'm turning the wrong side of 50, but I have never been sterilized in spite of having 2 cesareans. And what happened to me is what I would practice for both my patients, and I've had 2 C-sections. So I educate the patient. Going a little off track to answer you on this one, I had a patient who had one kid who was about, grew up to be 18 years of age, and the second daughter who grew up to be 12 or 13. And at 18 years of age, the son was diagnosed with a bone cancer. Within the year, and she had got sterilized by me in her second pregnancy many years ago. Whoever knew what was going to happen to her older child? He was already 5 years old when the second one was born. I really felt very, very bad that I was the one that decided to close her future fertility potential. I made her go through IVF, and at a very late age of reproduction, I delivered her. So, yes, I'm very happy for her that today she has a complete family, though the difference between the 2 children is much, but she's able to overcome the grief of losing her first child.
Something that nobody, I think nobody would be thinking of, and I'm
Nobody
so
thinks about the
grateful
worst
to
way
you
there.
Yes.
to throw light on this topic so beautifully.
It's very important, to address this. People don't talk
Yeah,
about it
people don't
openly.
talk
It's,
about
it's
it.
very
See,
important to address.
Women's health has never been priority for anybody because the poor women were only the pillar, the center, family, society, etc. But nobody spoke about their health. So whether it is mental health, whether it is reproductive health, whether it was contraception, whether it was menopause, women were never given in as much as importance as they do deserve. But today, everybody realizes a happy, healthy woman is a happy, healthy family, is a happy, healthy society. So now everybody is kind of going back to basics and trying to look after the welfare of the woman first.
As women age, I mean, irregular periods and bleeding, that becomes a phenomena, and most of them choose to ignore it. And what do you think are the major red flags when it comes to the perimenopausal phase?
Perimenopause is the phase before menopause. So let us understand what menopause is. It is a retrospective diagnosis, meaning you stop menstruating or bleeding for a year. Then you are known to, definition of menopause is absence of menses for a year, a pause of menses for a year. So what is perimenopause? Instagram blew it out of proportion. It is only, everybody is now focusing because Amma, Nani, Dadi, Mummies all went through menopause, never had any issues. Today, suddenly, a lot of us are talking about it. It is the phase before menopause. It means declining fertility. Premature menopause is people before the age of 40, if they stop their menses, that is called premature ovarian failure or early menopause. Anything after 40 is accepted as normal. General age today, somewhere around about 50 to 54, most of the patients are getting menopausal. Irregular bleeding patterns happen in the start of your adolescence and when your fertility is waning. That is because of irregular ovulation. Your eggs are drying up. So regular 28, 30-day cycles are not happening. That is why you're getting irregular periods. It is called today as abnormal uterine bleeding. How much you bleed, you have to be careful. If anything out of the ordinary, a shorter cycle, often getting periods often, bleeding more than 3 to 4 pads a day, which was your normal, these things you start getting concerned about, because the incidence of cyst, ovarian cyst, incidence of fibroid uterus, incidence of cancer of the uterus, all of this starts later. So you need to be able to diagnose it early, because the treatment is really very, very easy. So what does a woman do? I would advise every woman over the age of 40 to please gift herself an executive health check in whichever hospital she wants, where she does a complete check from tip of the head to the tip of the toe. It is not a money-making gimmick. It is you being physically and mentally aware of the changes that are happening in your body, and you can take adequate treatment to prevent untoward incidences. It is so easy. Please do it. It definitely helps every patient improve her quality of life, because now age is no longer 55 and 60 years. We're all living till 85, 90. So when the post-menopause phase, the age has got longer, you need to look after the woman through that big span, rather than leaving her open to pick up any kind of a medical disorder like diabetes, hypertension, hypercholesterolemia, fatty liver, cancers anywhere, breast, ovary, cervix. So there are so many things which can be easily picked up and treated earlier.
Yeah, very
Very
true. And
fair.
I think while we're talking about menopause, it is also important to address the myths or misconceptions that people are having these days, especially when right now women turning 40 or 45, they start getting worried a lot. Suddenly, a thing like कि weight increase हो रहा है तो शायद menopause आ रहा है. So what are certain misconceptions that you would like to address?
Again, going back to basics, menopause affects from the tip of your head to the tip of your toe. So from brittle hair, frizzy hair, hair fall, acne, obesity, which is more central obesity, buttock and abdomen kind of starts getting bigger, some amount of hirsutism. All of this starts affecting mood swings, brain fog. Suddenly you can't just think right. What is all this associated with? Decreasing only one thing, which is estrogen hormone, which is representing your ovarian function. So you have to be able to pick this up. And the first person to tell you na is husband. Because they are the punching bags and they'll tell you, ये अचानक भूत जैसे behave कर रही है डॉक्टर, मुझे समझ में नहीं आ रहा है इसको क्या हो गया है. That is when you actually say, अरे इसको कुछ तो, let us get her check. Sometimes people use menopause and perimenopause as an excuse to remove their frustration, which is all the educated women are aware of all of this. Don't quote me on that. But other than that, genuinely, it can affect so many things in you. So the husbands come and tell you, you kind of hold their hand, you give them treatment, which can be, basic phytoestrogens, could be hormone replacement therapy, could be oral contraceptive pills, which is basically correcting her hormone imbalance and protecting her cardiovascular, which is heart, and bone health, which is very, very important. Lifestyle in this time is extremely important, because now they're empty nesters. Most children have flown away. All the women, husbands are busy with work and their usual lifestyle. Women are either kitty partying or they are sitting at home, no one to cook for, no dropping, picking up, school, and all the other activities. They tend to put on weight. So these are the ones that need to be thrown into the gym, get personal trainers, you get a personal nutritionist on board, so that they start feeling good about themselves and the changes that are taking place in their body.
Automatically, the hormones balance themselves.
Absolutely.
Yeah. I think we just summarized it all from womb to tomb, and
Yes.
starting with adolescence, pregnancy, and We could not have thought of anyone else other than you for such an important topic. And I know we've addressed a lot of issues, and the viewers are going to get gold from this episode.
Thank you
I am
Absolutely.
very positive of it. And before we let you go, we want to have a quick rapid fire with you. So,
Shoot.
are you ready?
I'm always ready.
So, here goes a rapid fire, rapid, quick one line answers. Does eating certain foods actually help control PCOS?
Not eating a lot of food helps control. Eating certain foods does not.
Is exercising during pregnancy safe for most women?
Extremely safe.
Yeah, even during the third trimester.
Absolutely. I've
Yeah.
had German women that do deadlifts of 100 pounds and they're doing very well.
Great. Can stress actually delay period?
Absolutely.
Is infertility always a women's problem?
No, only 33% causes are female, 33 are men, and the rest of it is unexplained infertility.
Does menopause automatically mean weight gain?
No,
Do birth control pills affect future fertility?
absolutely not.
I think it was quick, rapid fire, and thank you so much once again for coming here and doing this. And that's what Hustle and Heart is all about. And I'm sure our audience is going to love this episode.
Thank you so much, Tanvi, for having
Yeah.
me over. And I hope I've been able to do justice to your kindness of calling me
More
here.
than justice, yeah.
Thank you so much.
Thank you.
Thank you.
Today's conversation really reminds us that a woman's relationship with her body is a lifelong journey, from adolescence to motherhood to phases we rarely talk about openly. And the more we understand our bodies, the more confidently we can live our lives. If this episode resonated with you, do share it with the women in your life. And of course, don't forget to like, subscribe, and stay connected with Hustle and Heart, because in the next episode, we're bringing you another powerful story about life choices and everything in between.